there is often an inappropriate focus on acute disease because there's an urgency it brings with it, and there's an immediate threat to life that it brings with it. What's often not understood by healthcare systems as you stand back and look at them is that if you really moved earlier on and focused on chronic disease, you may actually never get to a significant percentage of acute disease. So it's long overdue. Chronic diseases have always existed, and the burden has crept up on us. I mean, think about this room. 3 or 4 of us in this room have one chronic disease. 2 or 4 of us in this room have 2 or more chronic diseases. Anyone in this room who's over 65, if you put the group together, 90% of that group will have one chronic disease. You got things like hypertension, that's 32% of America, and that's twice the rate in countries that are comparable to us. Obesity is almost 1 in every 2 people. Diabetes is 12%, and we're much higher in our rates than other countries. And then you think about total cost of care. That's through the roof. 90% of that, a lot of people may not realize, is driven by chronic disease. Almost 5 trillion, about 4.9 trillion. So as you think about that, and then the workforce has challenges as well, right? A workforce shortage. We must, if we're really going to transform healthcare, we've got to think about what constitutes the majority of the disease burden. An integrated, coordinated, seamless connection for the patient between all levels of care, all the way from home to the pharmacy, to the hospital, to the ambulatory care center. So I think the biggest misconception is that this is simple. And the biggest misconception is that any one person can crack the nut. No, it's complex, it's confusing sometimes, it's maybe inefficient, the current healthcare system, because a lot of that is negated by the overwhelming fee-for-service model.